Dr. Vincent Eletto is our health expert here now to discuss antibiotics and asthma in children. Good to have you here. There's a rise amongst children.
Yes, there is.
Why?
Well, it seems to be that there's been a rise because antibiotics have been given to children for things such as the common cold, the flu, within the first year of life, especially in infancy, where we find that children are developing their immune system. Antibiotics, especially the broad spectrum antibiotics, the ones that kill many bacteria, seem to knock off the normal flora, the good bacteria in the intestines, which is helpful in the development of the immune system.
And now how is this linking to asthma? How is this causing an increase in asthma?
Well, we believe that it interferes with the development, the normal development of the immune system. And since it knocks off those bacteria, children aren't permitted to develop the normal immunities they should, making them susceptible to many, many allergens out there.
Fill us in on what you found out in the Vancouver study.
They looked at about 12,000 children, and they found that by age 7, those children who received antibiotics more than doubled the likelihood of developing asthma. And the interesting part of this study is that these children were low risk. In other words, their mothers did not have asthma. So they were not destined to have asthma, yet they developed it. So they took it a step further, and they looked at another 27,000 and found that 1,800 more had developed asthma, making them 1.16 times more likely to get asthma. Getting a second course of antibiotics increased it even more.
So there's fodder for parents who say, I don't want my kids to have all these shots, because there's a rising chorus among parents who say, I don't want all these inoculations, all these shots for my kids.
Yes, but that's a double-edged sword. Because while we look at the diseases, the childhood diseases, and say, okay, we're wiping them out, well, not really. We're just, nature has a way. And what we're doing is suppressing it. And then if we don't inoculate, we see measles now on the rise. We're looking at pertussis on the rise again. Whooping cough is showing up once more.
Kids get sick. They do need medication. You talked about a broad spectrum antibiotic. What antibiotic is safe for a young child? Because we're talking about 0 to 12 months here, overuse of antibiotics. Is there a specific one that is the culprit?
Well, they've looked at a lot of the cephalosporins, which is related to the penicillins.
My son is allergic to cephalosporins.
It covers a lot of bacteria, and people tend to use them for ear infections.
And that's what he had.
Many ear infections are viral. Most upper respiratory infections, bronchitis, are viral.
And viral, that doesn't respond to an antibiotic.
Doesn't do a thing.
Right.
Does not do a thing. In fact, between the 1977, I believe, early 90s, there was a health crisis issued by the federal government because of the increase in use of antibiotics in children, leading to bacterial resistance.
Wow. So what resorts do parents have if we look at these studies and we listen to parents at home listening to this, say, well, I don't know if I want my kids to have all these antibiotics, but I know I've got to do something to ensure their health.
Well, I would say that the best thing I find in my experience is a tincture of neglect is often very good. Watch that fever. Look to see if the child is acting sick. If they have a fever and you give them a Tylenol and the fever comes down and they're running all over the house and they're eating, odds are that they don't need that antibiotic. Odds are they just control that fever, you know, and they'll be okay. The body's response is to mount a fever because it protects them. It actually attacks the organisms much better with a fever.
And you know, I'm a mother of 3, and my little boy right now has 103 fever, and I'm going to let it ride it out, alternating Tylenol and Advil or acetaminophen and what have you. But many parents, they worry, they are on a rush, they want to make sure their child, because of their intentions, is taken care of. You know, how do you know? We
see this often. In emergency medicine, we see a lot of parents come rushing to an ER with a child who has fever. And being a physician who will not see that child again, many physicians feel they have to prescribe an antibiotic. I feel that what we must do is get them to their pediatrician, have their pediatrician check them in 2 days again, and make sure this child is getting well.
But we're seeing specifically, back to our original point, a rise in asthma. This is something that stays with children lifelong, or is this something that can be cured?
True asthma is a chronic condition. It will stay with you forever.
And is this specifically what's happening? Antibiotics are causing chronic asthma.
Yes, we believe it is. We don't have a direct cause and effect, but the studies are indicating that this is what's happening, and it's truly compelling. We have to do much more research into this, because if this is a cause, then we have to stop it.
Are you seeing much more of this in young adults as well, and adults as they get older?
We're seeing more and more bronchospasm, which is what it is. It's tightening of the bronchioles. And we see this occurring in the common cold. I believe that there's many allergens out there that people aren't aware that they're allergic to. Dust mites. Many people now have air conditioning that they need to clean those ducts out. And this could, even the carpet fibers, and this is something that we really must get a handle on. We are seeing much, much more of this.
All right. Well, thank you so much for sharing your insight and analysis and helpful tips.
I thank you.
Thanks, Doctor.